Hello everyone, this is Aldona speaking. I'm going to be doing a recording for our class 6 because it's asynchronous. So this is a video that you need to review on your own, listen to some of the videos that are embedded into this PowerPoint on your own as well, and a couple activities that you need to do on your own and submit to your e-portfolio. So let's get started. So last week we looked at the healthcare structures, we looked at different organization, regulatory bodies, we looked at boundaries, personal-centered care, therapeutic nurse-client relationships, and we did a couple activities during the class as well, especially the one at the end where we did the different organizations and how you can get involved. This week, we're going to look at interprofessional relationship, intraprofessional collaboration as well, which is influenced by value, power, gender, culture within the community styles, and look at some standardized nursing reports such as SBAR or ISBAR, sometimes it's called, IPAS, and others as well. Look at teams steps and communication safety tools. I have those videos that are embedded in activities throughout as well. So, group process. This is an interprofessional healthcare teams is delivered through quality of care to improve the intrapersonal function of individual members, to support a better solution to implement that safe working environment related to could be issues related to such as wait time, transfer process, introduction to programs and procedures as well. So group size matters, depends what the group that you are working with. Number of individuals interact to achieve a common goal. So if you have a larger group, sometimes the common goal is harder to find, especially when you are doing or working with interdisciplinary team that has different views, right? But if it's a smaller team, it's easier to achieve. This is really to establish collaboration, decision making, and really the ultimate goal is that patient safety. Characteristics would be shared purpose and mutual goals. So once again, if it's set up right away, what the goal is, when you are working in a groups, even think of the groups that you are working with to create those presentations that you're going to be doing later on in the semester. Active participation and role differentiating, role defining within the group is very important, such as, what are your strengths? What are your weaknesses? What is it that you want to work on? Creating those norms, creating those expectations of the group, and providing feedback and reflection that is guided throughout. So here I have an example for a Code Blue team, and I'll tell you in a minute why that is. So remember a few weeks ago, we worked on your SMART goals. You can relate the SMART goals to the group as well. You can have specific, measurable, achievable, realistic, and time limited. So specific would be identifying what is the specific goal, and that is detailed, that is focused, and is clearly stated. Measurable. So it has to be something that is measured for the goal to be achieved. The goal needs to be quantitative in order to measure and how much and how well the goal will be implemented and realistic. Achievable. So this is the ideal goal, needed to be challenging, but not so difficult that they are not attainable. It has to be attainable, achievable, something that is realistic, within the time frame that you give to that goal to be achieved. The types of groups in healthcare, so we have therapy, support, activity, and health education. So therapy would be reality testing, it would be strengthening personal resources. Support is giving and receiving that information and advice. Support coping skills, promote self-esteem, strengthening that hope and resilience. Activity would be getting people to touch with their body, releasing energy, enhancing self-esteem, encouraging cooperation, stimulating spontaneous interaction, and supporting creativity. So that's under that activity type. And the healthcare educational health education would be learning new knowledge, promote skill development, provide support and feedback, supporting development of competency, and promoting decision of improvement within the healthcare team issues related to whatever the team is working on. So therapeutic groups, members must benefit from the group. So when I mention, a healthcare team is working to a specific goal, it has to benefit the healthcare team as well. So it has to be within the scope. So if you think of nursing and what we do for our patients, it has to be within our scope of practice, what we can provide. We have the work or the task groups. This is based on the purpose and require expertise. Functional simulated would be chosen members who are intellectually, emotionally embedded into the group, the task group, complementary skills, knowledge, and commitment to goals, and promote faster norms forming of the task. And interpersonal compatibility would be enhancing cohesion, task interdependence, and really the collaboration within the team. Extreme differences can hinder group acceptance and participation. So the power dynamic of the interpersonal healthcare team would be some factors such as team-related factors, role-related, communication, trust and respect, individual-related factors. So the team dynamics within the actual healthcare team. Group norms. So what does that look like? So these are the norms that are sometimes unwritten behavior rules that are expected within the group from the group members. Sometimes they are written norms as well to help with the cohesiveness of the group. So some of the universal norms would be confidentiality, regular attendance, and in-group communication. So if you think of your own groups that you are working towards that presentation, how do you communicate with them? How do you expect other group members to submit what is required or complete or reply to, your messages, your emails that you are sending? What is that in-group communication that is happening? Okay, group specific norms. This could be respect and equal participation, right? You want to make sure that everybody has kind of that available and accessible resources and be able to participate equally. You don't want to have one person doing majority of the work and the other people are not, or certain individuals might be saying I'm not having the opportunity to participate, and certain ones saying that they have too much opportunities. So the norms would be kind of a balancing and handling that conflict within the team, and what kind of styles are you dealing within the team, such as personality styles. So one of the things when you are working with your group, you have to do that group contract, which asks for kind of specifics, what the group's norm expectations are, that hopefully you guys can, coordinate and develop and input into that group contract. So group dynamic. So individual members, this could be variety of different things that could help or impede the working within the group, such as personality, motivation, confidence, group as the shared purpose, who's going to be a leader. So that leader, is it that each one of you will take a turn each week to be a leader, or are you choosing one person to be a leader throughout the entire assignment? For example, so integrating that multiple areas of function processes, that collaboration, the communication, and how do you manage conflict if something happens, or you can't, get a hold of someone, or the expectation is to submit a certain portion of that assignment, but it's not submitted. So how do you handle that? So benefits of really working in a group that works well, it builds membership confidence, enhances the intrapersonal communication skills, and promote cultural awareness and inclusivity. So it feels like that you are working well together and you have a common goal, and once again, you can relate it to the groups you are working with, or even the groups as a healthcare team when you're going to be working towards providing the most efficient way to a patient, whatever the situation might be. So here is a video that I'm going to get you to watch on your own. I'm not going to play it during this video, not to take the time within this video. It talks about team dynamics, and it's part 1. So review this video. It's about 6 minutes or so, and then answer these questions. So I have reflective questions right after you watch that video and before you move on into the other presentation. So this one, there's 3 questions under understanding and analysis, 3 questions under the application and synthesis of what you have watched, and 3 questions under critical thinking and metacognition. So really, emphasize for at least choosing 1 question under each of these subheadings and work through it. I do encourage you to, of course, do all of the questions, but it's okay if you kind of review what kind of the theme is per each subheading and answer those. So that could be one of the activities that could be included in your e-portfolio. Then go ahead and watch this video, which is part 2, and see the kind of improvement in the teamwork within that code blue scenario. And then reflect on this. So what team dynamics did you observe in this video? So which, positive team dynamics did you see? So strategies that can be adopted to address factors associated with power imbalance. So, think about, once you watch those videos, think about, what the doctor took as a role within the situation of that code blue. Where's that power imbalance, and how do you balance that imbalance, right? So what are those collaborative approaches? Having, an open door policy. What does that actually mean? What is an open door policy, right? So it could be related to somebody being open to feedback, to that direct communication, to reflection on a certain situation, having education and mentoring opportunities, and having maybe different individuals taking those leadership roles within that team. So group process, this is what it looks like. So it starts off with number 1, so it would be forming. So the group gets formed. This is where the purpose is really unclear still. What are we doing? What are we supposed to be doing? The introduction to group rules and norms, completing that group contract if it's required, if not, it's required. And then you're going to go move on to number 2, that's storming. So that power and control, the conflict and power struggles, and kind of organizing the goals of the group. So what are we doing? How are we doing? What are kind of the internal deadlines for certain tasks within the group, for example? I'm referring it back to the groups that you are working in for the group presentation. Then it's norming. Norming would be individual group goals aligned. The group is working well. The clear goals and responsibilities. Everybody kind of knows what they're supposed to be doing, when to do it, when to submit those internal deadlines, what to submit, where to reach out if there's any kind of information needed further, how do you communicate. So it's norming. So everything is kind of on a neutral level and everybody works well. Performing would be collaboration or friendly competition, maybe effective group structure, and focus on those tasks achievement. So continue working within those goals, within what is required, and focus on that task and achieving it and meeting those deadlines and work to that big deadline of submission of that assignment, right? And a during would be that end determination of the group. So task completion, submitting the assignment, doing the presentation in the classroom, and maybe reviewing or reflecting on personally or as a group, how did you do within that group? So task functioning, so behaviors to attain group goals would be initiating. So this is initiating task goals. Group problems suggest relevant strategies for problem solving. Seeking would be seeking information, opinions. So asking others, right? What can you help me with? Or I'm not sure what I need to submit, or, how to work within maybe a certain, like a PowerPoint, for example, if you don't know, if you never worked with it, seeking out from others. Giving would be giving information or opinion. So others could provide you, say, hey, you know what? I know how to work on that PowerPoint. I've done lots of PowerPoint presentations before. I can help you out. Instead of actually doing the presentation on PowerPoint, but actually using the PowerPoint to provide and give information. Clarifying would be really clarifying the ideas, the suggestions within the group, paraphrasing some of the key information that is within that group. Summarizing is pulling it all together, those ideas. Offers the group solution and suggestion for other members to accept or reject. So do you like, what we're putting together, or maybe reject it and come up with some new ideas? And talking would be really that communication piece within the group and group to test the possible decisions. Maintaining function will be harmonizing. So attempts to if there's a disagreement, to help members reduce the conflict, to explore differences within whatever the matter is in a constructive way. Gatekeeping would be helps keep the communication channel open. So someone that is reaching out for clarification, to reaching out to others, to make sure that the communication flows well. Encouraging would be indicates by the words or body language unconditional aspects of others. Agreeing or maybe disagreeing, such as a friendly little smile or nodding of the head. Compromising would be admitting that mistake. Say, you know what, I did make a mistake. I'm so sorry. I will compromise, and we can work with your suggestion ideas. And setting standards. So call for the groups to reassure that or confirm what is happening within that norm and the appropriateness within that. The non-functional kind of self-roles or roles within the team could be someone that is aggressive, someone that is a blocker, saying, no, we're not doing that, I'm not doing that. Someone that maybe jokes around too much, someone maybe that is avoiding everything that you are doing, even the meetings, or maybe like ghosting, for example, of communication piece. Self-confessor and recognition as well. So, I've done all the work, so I don't have to do anything else. That's what recognition means. Here are some characteristics of effective and ineffective work groups. This is right from your book, so have a look at those. I will just highlight maybe one through here. So right in the middle, decision making is flexible and adapts to a group needs. So that's effective. Ineffective would be decision making occurs with little to no consultation, and consequences is expected rather than negotiated based on the data. Group thinking, this occurs when a group becomes too cohesive, leading members to prioritize consequences over critical evaluation. Some of the warning signs within this would be illusion, collective rationalization that disagrees with warning, beliefs in unacceptable kind of decisions within the team, stereotypes or negative views of people, direct pressure, and mind guards from others within the team who withholds data that would be problematic for group thinking activities. Okay, there is an institute called Canadian Patient Safety Institute. This is where the safety of the healthcare, a pursuit of the unsafe, so collection of the unsafe acts within the healthcare team and looking at practices to, what happened in those unsafe practices, and optimizing the patient's health outcomes, how do you prevent further kind of complications or the scenario happening yet again. Here is another video. This one's a little bit long. This one's about half an hour. So this is using a team steps. The team steps is the team strategy tools to enhance performance and patient safety. It really focuses on the team structure, communication, leadership, situational monitoring, mutual support. This is the team principles that are embedded into effective teamwork. Okay, so have a look at this video and reflect on what is happening on the video and how the team steps framework is included within the 5 key concepts. Patient harm. So here is that Canadian Institute for Health Information. The patient harm is the rate of unintended hospital harm is about 6% of acute care hospital. So roughly 1 in 17 hospitals stay involved in at least one occurrence of unintended harm, just to let you know. So the harm is only counted if occurrence after admission, so not present on admission. It requires treatment, changes in treatment, or prolonged hospital stay. It fits into 31 clinical group categories in hospital harm framework, such as medication error, infection, procedural complications, and patient accidents. And it costs about 4 times more per one incident for that patient harmful event that occurred. Just culture, it is a way of implementing safety within the organization. So this is really, having open communications with healthcare teams and stating maybe something, I'm concerned about patient safety, possible maybe infection or sepsis. I'm comfortable, I'm discharging this person today because of so-and-so. This is a patient safety issue. So having, that open communication with others, having a trust in yourself, trust in the system, that you're providing the safety to your patient. So what strategies should be used to reduce the near misses and errors discussed? Well, some of the strategies is closed loop communication. We talked about that. So that face-to-face or on the phone. Track back methods of health teaching. So asking, your patient to repeat what you just taught them. And using tools such as that IS-bar or S-bar, bedside reporting as well, huddles, we'll talk about that in a minute, and using the whiteboards in the patient's room for updating the information so the patient is aware. So nursing reports, you might hear something called TOA, so transfer of accountability. This is the handoff report at the end of the shift when you're reporting to another nurse, and as you are leaving to go home, what is happening or what happened throughout your shift. Okay, so standardized communication that are most common you will see within the organizations, the hospitals you're going to be working at, is SBAR, ISBAR. This stands for Introduction, Situation, Background, Assessment, and Recommendation. IPAS stands for Illness, Severity, Patient Summary, action list, situation awareness, contingency plan, synthesis by receiver. And so what is the purpose of standardized communication tools? So, why do we have these within the healthcare team? What do you think? So that's kind of a food for thought for yourself. So I want you to go into eClass under class 6, choose one of the 4 patient scenarios that are embedded into the class 6 and complete this ISBAR tool. Okay, as you are learning what ISBAR means, and include this scenario into your ePortfolio. So ISBAR is data identification, situation, background, assessment, recommendation, and then you'll read the little scenarios and complete this from the scenarios. You can go ahead and watch this video first. This is a really good video where this person explains to you what that situation, background, assessment, recommendation means. That I is missing, but that's okay because we used to implement it into that situation. So introduction of yourself, but now sometimes you might see ISBAR or SBAR. It's both same thing. It's just that I is the introduction of yourself to whoever you're reporting to. So go ahead and review this video. It's about 10 minutes, and then go ahead and complete that activity. IPAS, so that is the verbal handoff tool. So this is at the end of the shift where you're going to be providing and maybe even charting it this way. I know the tool for medical records that is using Epic use this IPAS as a way of handing over the report at the end of the shift. And here's a quick video what IPAS is. So have a look at that. And then I want you to go ahead and do yet another activity, which is putting in all of this that you just learned from the videos, from doing that activities and learning from what the communication tools are, doing this virtual simulation game. And how you're going to go through this game is just follow the prompts on the bottom. So this one says start the virtual game simulation. You'll go ahead and read through or listen to the video, choose the correct answers or any of the answers. It's okay if you choose the incorrect. You can go back and choose the correct one or another answer and move forward within the simulation video game. Okay, here is that access to the virtual simulation game as well, or it's in the speaker notes. Okay, so go ahead and do that as a practice. And then I'm just going to review some of the safety communication tools. We just went over the ISBAR and IPAS. There's also call out and call back. So call out is to ensure critical information is shared loudly, clearly during the emergency and rapid response situation. So for example, patient oxygen saturation is 85, starting bag mask valve ventilation now. Okay, so think of that when you watch those videos for the cold blue. Did you see that? And check back would be that closed loop communication tool where the sender gives the message, the receiver repeats what they heard, and sender confirms. Okay. Next is huddles. So hospitals, long-term cares do huddles where everybody gets together, usually maybe within an hour of starting a shift. It's a brief focused team meeting to plan anticipated challenges and assign roles. So everybody's kind of has a clear role what they're doing. It's usually at the start of a shift, before procedure, maybe during unexpected patient deterioration as well. Then we have CUS words, so concentrate, uncomfortable, and safety. So examples would be to standardize ways to assertively voice a safety concern without a conflict. So something like, I am concerned about this dosage. I am uncomfortable giving this order. This is a safety issue for the patient. So really, the benefit for this is empowers nurses to speak up about patient safety using that respect assertive voice. What is this really familiar to what we just talked about is that culture, right? The culture that you are creating within that safety of the patient. Next is to challenge rules. So this is encourage speaking up if a safety concern is ignored. So voicing your concern, repeating more assertively if it is not acknowledged what you are saying, such as, my patient safety is at risk, for example, or I'm concerned about my patient's safety. And the benefit is really the voicing what you are concerned about and for safety of the patient. Safety communication tool. This is a brief and debrief. So sets expectations for clarity of the rules. So this could be like a surgical prep, and debriefing would be reflecting on the event. So think of those post code blue events. Here is a little bit of a reflection activity that you can do as well and submit it to your e-portfolio. So think about how do I react in a challenging situation? So that is kind of the question of this week. And you can use the what, so what, and that what. And here are some guiding questions. That is all for this week. Thank you so much. Reading week is next week, and then I will see you the week after that. Thank you, and here's your references. Make sure you watch those videos and do those activities. Thank you. Bye.